This is JAPI, and welcome to JAPI Podcasts.
Hello, everybody. I'm Dr. Agam Vora, and I welcome you all to JAPI Podcast, volume number 72 with issue 7, with editor in chief, my close friend, Dr. Mangesh Chivaskar. This issue of JAPI has some real interesting articles, including 10 original articles, 2 review articles, and a consensus statement, also as an update article. There are 3 case reports, 1 case series, and a pictorial CME. Let's discuss that. We start with an important editorial that we have this time is on Takayoshi's arthritis, emphasizing the necessity of early diagnosis and informed medical management. Authored by Rohini Saman and Bishakha Swine, this piece sets the stage for deeper discussion on this critical condition. It conveys that early diagnosis of this arthritis through greater awareness of its varied clinical presentation and judicious imaging is the need of the hour. Since patients with this can present to a variety of specialists, including physicians like you and me, nephrologists, gastroenterologists, cardiologists, rheumatologists, this awareness needs to extend across all subspecialties of medicine. Better composite outcome tools and biomarkers are needed for the assessment of disease activity. Medical management guided by disease activity is the mainstay of treatment in Takayoshi's arthritis and is rewarding in majority of the patients in experienced hands. Interventions should be reserved for refractory disease or critical organ ischemia. A team approach, including interventional radiologist and vascular surgeon, can ensure the highest level of care for this complicated patients. The original article we have is the first one in the series is a comprehensive cross-sectional study from West Bengal, which explores the prevalence of thyroid disorders among type 2 diabetes mellitus patients, and it is by Arnab Bhattacharya and his group. This study conveys that poor control of type 2 diabetes is significantly associated with thyroid dysfunction, thereby highlighting the importance of glycemic control and regular assessment of thyroid status amongst type 2 diabetes patients. The next original article is by Dr. Jitendra Sisodia and his group, and it talks about study of diagnostic yield of nucleic acid amplification test amongst tuberculous cervical lymphadenitis in immunocompetent patients. The TrueNAT or the nucleic acid amplification test assay should be used as an adjunctive test to addition of the conventional cytological examination of FNA sample of lymph nodes for rapid diagnosis of tuberculosis. It has additional advantage that it detects rifampicin resistance simultaneously. Smita Chauhan and her group talks about longitudinal prospective study on dynamics of antibody response to Covishield after 6 months. There is a waning of antibody titer over time post-immunization. A lower antibody titer can be contributing factor for infection that emerge later. IgG levels post-vaccination do not differ according to age, since the relationship between Ig levels and age was weakly correlated and was statistically insignificant. Ramkumar, Sajid Kumar, and Gayatri looked at hypomagnesemia in patients with type 2 diabetes with the objective to assess the prevalence of hypomagnesemia in diabetes mellitus patients and to assess the association between this and microvascular complications of diabetes mellitus in a tertiary care hospital at North Kerala. They concluded that lower magnesium is negatively correlated with HbA1c and fasting blood sugar, but not related to duration of diabetes and gender. The prevalence of microvascular complication was higher among diabetics with low magnesium. Dr. Panikar, Dr. Joshi, Dr. Apurva and his team did a cross-sectional study to understand prevalence and association risk factors according to liver steatosis and fibrosis stages amongst non-alcoholic fatty liver disease in patients with type 2 diabetes in India, and concluded that higher prevalence of NAFLD, that is steatosis and fibrosis, in type 2 diabetes patients, increasing the risk of advanced fibrosis. Type 2 diabetes patients with risk factors including waist circumference and body mass index, appropriate screening and interventions are required. Vivek Verma, Ashwini Mishra, Rajiv Narang studied parameters, procedures, and calculations for the statistical determination of sample size for different clinical study and designs. Through his study, he gave a good education and learning source for medical professionals to pick and choose the specific scenario and estimate of sample size. The next original article by Uma Sundar, Amita Mukhopadhyay, Suresh Sundar, and Nilesha is on normative cognitive scores in Western India, stratified by age, rurality, cognitive domains, and psychiatric comorbidity. Indian ethnic and educational diversities necessitates obtaining normative cognitive data in different populations. The group aimed at evaluating cognitive scores using Marathi translation of Kolkata Cognitive Battery called KCB and to study the association of these KCB components with depression and socio-demographic variables. They concluded that this Marathi KCB, having been validated on large urban as well as rural sample, may be used to study cognition in Marathi-speaking population with appropriate cutoffs tailored to degree of urbanization of population. The next original work by Bansi Kumawat, Indrajot Kurpan, and Vasudev Sharan Parashar is an observational study of various risk factors and etiological profiles in patients with lower back pain at tertiary care center. And they concluded saying that lower back pain is multifaceted condition which is influenced by age, gender, BMI, and lifestyle factors. Effective management and prevention strategies should consider these risk factors to improve patients' quality of life. A comprehensive approach is essential to address the complex etiology of lower back pain. Another original article by Pratik Watkar and Paulomi Deshmukh and the group is on prediction of micro and macrovascular complications in type 2 diabetes using heart rate variability. The group looked to explore the utility of heart rate variability, a non-invasive marker of cardiac autonomic activity, as a pre-screening tool for prediction of micro and macrovascular complications of type 2 diabetes. The study concluded that significantly reduced heart rate variability, stronger the association with complication. 85% sensitivity and 74% specificity and 78% accuracy of classification make a heart rate variability indices a promising pre-screening tool to predict micro and macrovascular complications in type 2 diabetes. And the last and a very interesting original article the current JAPI has is on evaluation of red cell distribution width and its ratio to total serum calcium as a predictor of severity in acute pancreatitis. And it is by Chivant Shivkumar and Geeta Kampani. And they concluded that red cell distribution width and the red cell distribution width by total serum calcium ratio are comparable to bicep index as predictability of severity in acute pancreatitis. They offer a cost-effective and readily accessible means to forecast acute pancreatitis severity upon admission, making it prompt intervention right in the beginning. Next on the cards is very interesting review article, and review article is on edema India. It is the executive summary of screening, diagnosis, and management of edema by Dr. Girish Mathur and his group. The management of edema requires systematic approach to screening, diagnosis, and treatment with an essential initial assessment to differentiate between generalized and localized edema. Association of Physicians of India aimed to develop a first Indian edema consensus offering tailored recommendation for screening, diagnosis, and management of edema based on insights from expert panel. Panel suggested when evaluating for edema symptoms, important factors to consider must include patient's current illness, medical history, risk factors, family history, and the history of ongoing medications. Key diagnostic investigation for edema should include a CBC, cardiovascular imaging and markers, deep vein thrombosis assessment, along with renal, hepatic, and thyroid function test. Edema management involves a combination of pharmacological and non-pharmacological interventions, including limb elevation, physiotherapy, compression therapy, fluid removal, and diuretics. A sodium restricted diet is also recommended. Panel believed that educating patients could foster a preventive mindset, helping to prevent the worsening of edema. The next review article is by Dr. Mallikarjun Reddy and his group and is on algorithmic approach to benign prostatic hyperplasia, an Indian perspective. Benign prostatic hyperplasia is a preventive condition affecting aging men, necessitating a comprehensive and evidence-based approach to diagnose and manage. This manuscript, through the summarization of latest evidence, aims to establish a consensus amongst clinicians regarding optimal strategies for diagnosing and managing BPH to improve patient care and outcomes in clinical practice. The expert panel reached a consensus on 14 statements addressing diverse aspects of BPH, including tailored therapies for different patient profiles and necessity for unified diagnosis and management algorithm to enhance patients' outcome. Manmohan Mehdatta and Vasudhara Agrawal chose to write an update on autoimmune encephalitis, a hidden enigma demystified. The article zeroes in on autoantibody mediated encephalitis syndrome involving neuronal cell surface antigen. It sheds light on practical aspects of diagnosis and treatment, drawing from clinical experience in managing such cases. Additionally, it underscores the ongoing importance of neuroimmunological advances that will shape the future diagnosis and treatment of these conditions. JAPI, through this issue, presents a consensus on use of oral corticosteroids in people with comorbid diabetes by Bansi Sabu and 21 other experts. Short, intermediate, or long-term use of steroid in people with diabetes demands their rational use and holistic approach to identify, monitor, and treat complications induced or aggravated by steroids. Diabetes is a complex metabolic disorder with multi-system involvement. The comorbidities or the intercurrent illnesses that require short, immediate, or long-term use of steroid pose a significant challenge in the clinical management of people with diabetes. The complications induced or aggravated by such steroid may often be overlooked and become evident only when serious enough to attract the attention of physicians or the patient. It is important and part of treating physicians to be aware of likely possibilities with the use of steroids in patients with diabetes. Besides the management of glycemia, a holistic approach considering all possible complications arising out of associated therapies are necessary to maintain benefit risk balance in favor of patient. The current issue also has sarcoidosis, a biopsy with necrosis in mycobacterial endemic areas as a part of case series, and 3 interesting case reports on podophyllin toxicity, primary duodenal aspergillosis in diabetes, and pigmentation due to vitamin D deficiency. As a part of pictorial CME, the current issue of JAPI has embolized stent for branch pulmonary artery and stent by Ashwinian Group. This issue of JAPI is rich with articles that not only enhances our knowledge, but also drive forward the quality of patient care. Be sure to check out these articles and more in the July 2024 issue of JAPI, which is available online for you. Signing off, Agam Vora. Thank you very much.